Hi everybody, Ruechel here, and welcome back to the PCS Journal. We're going to sit down and talk with folks within Pinellas County Schools about what they're doing today. We're going to talk about health. And we're talking with Sara O'Toole, an RN, a BSN, Managing Officer for School Health Services. Good to see you.
Thanks, Al.
Now, I told her to bring along some visual aids, but fortunately she didn't bring along any of the immunization needles, so we're in good shape. I shouldn't start out on a negative like this. So what are the things that parents have to be looking forward to as we go into the school year? And I guess we should start by talking about what they're going to need as far as immunizations and why we have those kind of requirements, et cetera.
The requirements are in place due to Florida law, and so Florida law states that kids going into kindergarten and kids going into 7th grade have to have some required vaccinations. We'll look at kindergarten first. So for kindergartners, incoming kindergartners, it's always a good opportunity to go see a doctor or a pediatrician anyways, just for a checkup. You know, as parents are naturally thinking about going back to school, it's a great time to just go check in with their doctor.
Sure.
Make sure your kid is healthy, ready to start school, ready to learn.
Vision and hearing are
Yes.
two real key things, because if you don't catch it at the beginning of the school year, you don't want to get halfway through the school year and go, gee, Johnny can't read very well. I wonder what's going on. Maybe they can't see very well.
Exactly. And we always encourage kids who start acting out in class, we always encourage the parents to take them for vision and hearing, because sometimes that's how they manifest. Right. That they can't see or they can't hear, they start losing attention and they start acting out. So
now I know that when do they have to have all these shots? What kind of paperwork do they have to have? That's the big deal.
The shots are required before they start school, and school starts August 10th.
Okay, so school starts August 10th and they show up and they don't have their shots. What happens?
They will be turned away at the door. We have the opportunity to turn them away at the door. So they can't, yes, we have the opportunity to turn them away.
I like to rephrase that. You won't be let in.
We don't like to turn anybody away.
No, right.
Exactly. We don't like to turn anybody away. So we've actually had nursing staff working all summer on immunizations, calling parents, checking in the state registry to prevent kids from actually being stopped at the door on that first day, because we want to set a good positive tone for school for them.
Now, do you have any situations where I know that some people for religious reasons don't get the shots? Some people don't get the shots because of fear of possible side effects, although that's a medical argument. However, when people react to that, how do you deal with folks like that?
Florida law does allow for two types of permanent exemptions, they're called. The first is for medical reasons, and so these are usually children who are immunocompromised because maybe they had a liver transplant or a heart transplant or something like that, so they can't receive certain vaccines. That's a medical exemption, and we do recognize that, and they are allowed to be in school. The second exemption recognized by law is the religious exemption, and so that is issued through the Department of Health. They get a piece of paper that they have to provide to the school, and they just have to go into the Department of Health. The DOH issues it, they bring it to the school, and those children are allowed to be in school.
You know, give me the spiel, and I don't mean to put it that way, but about why it's good to have kids get these shots. I mean, besides the fact that it's state law, why do they need them?
Well, vaccination is the #1 way to prevent the spread of diseases. You know, that and hand washing, so everybody can wash their hands. So vaccination doesn't only protect your student, but it also protects the other students around, because you don't know.
That's the part that a lot of people don't get. Is when you have this many students that are involved in a certain area, man, if you get a disease or something, it can spread so quickly.
Right, exactly. And so you're not only protecting your own child or children, but you're protecting the other children in a class of 22 other kids, maybe. You know, and you don't know the health status of all those students in that room. And so maybe there was a student who is immunocompromised and can't have vaccinations, and they really depend upon the other kids around them, called herd immunity, to help protect them from getting diseases.
So give me some names if you can. I don't mean to catch you off guard here in terms of what kind of shots do the kids have to make sure they've had before they get into school?
So kindergartners need to make sure that they have had a DTaP.
What's that?
A diphtheria, tetanus, and pertussis.
Okay, right.
So that's whooping cough, tetanus. They have to have a second mumps, measles, rubella, or an MMR.
MMR, I've heard that.
They have to have a second chicken pox.
Okay.
And they have to have a polio.
Okay, now if you're following regular healthcare guidelines, these are things that you should have.
Right.
But in reality, there are some folks that have a difficult time paying for these kind of shots and stuff. Is any of this stuff free?
Sure, absolutely. So every Department of Health location in the county, and they are from Tarpon down to South St. Pete, they do offer vaccinations at no cost to parents. They can just walk in without an appointment and receive the vaccinations that their students need. And then also there are back to school fairs going on in the community too, and a lot of them are having vaccinations. The one I can think of off the top of my head is there's a big back to school fair actually put on by the Department of Health at Azalea Middle School on Friday and Saturday, August 4th and 5th. So that's tax-free weekend. And they will be offering physicals and immunizations at no cost to families, along with some other things too.
So, and then the other touchstone area is the 7th grade. What
Seventh grade, yes.
What kind of shots do they have to have there?
So by Florida law, 7th graders have to have a Tdap. So that's a tetanus, diphtheria, pertussis.
Okay.
Same family as a DTaP, just slightly different formulation. And that is just a booster shot from what they had when they were in kindergarten. But that's required before going into 7th grade.
And that's the only one?
That is the only required one. Now, there's others that we strongly encourage and recommend for adolescents, and those would be a shot for meningitis.
Right.
And especially if your child is planning on going to college someday, a lot of colleges are requiring that or strongly encouraging that. So get it out of the way now.
Oh, and that lasts for when you're up to college? Oh, I
Yep.
remember that.
So
okay.
if a student gets the meningitis at ages like 11 or 12, they'll need a booster after age 16, and then they're done.
Do you hear much conversation about the human papillomavirus, sometimes called the HPV? I know that's not mandatory. Give me a conversation about that. What exactly is that, and how do you get that?
So human papillomavirus is a virus that's spread through sexual contact.
Right.
And so the virus sits inside of your body, and it can cause different types of reproductive cancers. Along with oral cancers as well. And so HPV, the vaccine, is really been proven to be very effective in decreasing the risk of cervical cancer, oral cancers, things like that.
Now I'm going to try a stereotype in here. So, people said, well, my child doesn't need this because my child is never going to be sexually active. Well,
Al, we all know that's not true.
Well, okay, we all know that's true, but again, this is the logic that we're battling with that. So then let's talk about the other side about it, because again, you are dealing with some stereotypes out there that somebody will say, well, I know somebody that reacted to a shot and they got very, very sick, and that's why I just shy away from the stuff altogether.
Right. So vaccine reactions do happen. There's a database where they're tracked. They certainly are a possibility, but the possibilities are very, very small, and the benefits to your child and children around your kid outweigh the risks.
Now, the polio isn't a shot anymore. Is it still the liquid?
It is a shot. Yes.
Oh, it is a shot now?
It is a shot,
they
yes.
It. Remember
they
when
did. I got the shot. I don't know about you.
No, I had the liquid on the sugar cube.
Yes, the liquid on the sugar cube, yes.
Except I know one of my friends who had 6 sugar cubes. I'm going, oh, wait a minute. I guess he didn't want to take any chances with that. So let's talk about something else that parents are going to be concerned about. Does Pinellas County schools, do they have a nurse in every school?
Not full-time. Every school is assigned a registered nurse at least 1 day a week. But many, many, many of our schools do not have somebody on campus full-time.
Now, they've been hearing a lot of buzz about that in the legislature. Nothing got passed that way, but I know that Pinellas County is one of the counties that's either at least talking about it or what?
Right. So we've been working for many years to try and find community partners to come and help support the needs of our students, because the needs are ever growing. And our staff is not growing to meet the needs. It's not able to due to a lot of restrictions. And so we've really been trying to, go out into the community. Number one, spread the word, because a lot of families and parents don't realize that there's not a school nurse on campus every day, because either there was where they used to live or there was when they were kids, but it's not that way anymore. So we really need to spread the word about that. And then number two, tell parents and families that there is a proposal with our Board of County Commission to increase funding that would put a nurse in every school every day.
Right, and there's been, I know that several of the board members have spoken to me about that, about the need for that in general. So let's talk about a couple of other things. So during the school year, how many days is my child allowed to be sick before it's counted against him?
Well,
I know how many in the workplace.
Right, part of the nurse's job is to help keep kids in school.
Okay, that's true.
And so there's no limit upon absences. I mean, we have kids who are never absent. We have kids who are absent a lot. But schools do look at absentee rates, and they, try and problem solve around the kids. Once kids start missing, 10% of school, they really start looking at that and say, what are the obstacles? Why aren't the kids coming to school? What can we as a school community do to help support this kid, the student and get them back to school.
So if my child is sick, what are my responsibilities as far as the school is concerned?
Well, we always say if your kid, there's what I tell my own personal children, there's a difference between not feeling well and being sick. And so, and when mom's a nurse,
okay,
it's hard to pull anything over. But
okay.
If your students are sick, if they have a fever, if they're vomiting or have diarrhea, please keep them home because you don't want that spreading around.
I was just going to ask you about that because a lot of kids have these colds and sniffles. You still keep them home?
Colds and sniffles in the absence of a fever, feel free to send them to school. If they have a fever along with it, it's probably something a little more serious, and so keep them home till the fever's
Now,
done.
the reason I was asking that, if your child is sick, are you supposed to call somebody and tell them that they're sick?
You do have to call the school and call in the absence.
So let me repeat that,
right.
because that's scary.
Yes.
If your child is going to be sick that day, you need to call the school and
call
tell
the
them.
school.
Right.
Yes, and a lot of schools actually, if you go on the website, they have a little icon in the corner that says report an absence, and so you can also email an absence as well.
All right, like a little health advice. Kids come to school, breakfast. I know some schools serve breakfast, but generally, how do you get kids going in the morning? What's a good idea? Do you just give them Captain Crunch, which I loved for a while? I'm now advanced to shredded wheat and oatmeal. Oh, Lord.
How times have changed.
I've gotten a little bit older. But just in generally, health-wise.
Health-wise, it's important for kids to get an adequate amount of sleep for their age. That's really important because then they won't be tired in the morning. It is important for kids to eat a good, healthy, nutritious breakfast.
Do kids bring their meals to school anymore?
Some kids do, yeah, but every school in Pinellas County does offer breakfast to students.
So at what cost?
At no charge.
At no charge to kids.
Yep,
Have
no
they
charge.
had to increase the length of the day to do that or not?
Nope. Breakfast, I believe, is served in the half hour before school, the first bell starts.
Right.
And so, parents can drop their kids off and they can go have a nice, healthy breakfast in the cafeteria and be fueled up for the day.
That's right. It includes 3 flapjacks, 2 eggs over easy, thick cut bacon, a tall glass of orange juice.
Hash browns, don't forget
and
those.
hash browns. Man, you're making me hungry. How did we get on this? Hey, if you have any questions about your kids and shots and everything, you're available, right? They can call you?
Right, exactly.
Sara O'Toole. How can you forget that name? Write it down, Sara O'Toole. Good talking to you, Sara. Thank you so much for the information. Let's get off to a real good start this school year. Back with more of our program right after we take a short break.